Now comes the examination of the neck. Again, we'll begin with inspection. So you have to do the adequate exposure of the neck. You have to be careful when you are examining a female patient. Remember, if you are examining a female patient, there should be a female nurse with you. And you do an adequate exposure, not underexposed, not overexposed, so from the suprasternal notch clavicle to the angle of the mandible and the lemmas of the mandible. And here. First to the inspection, see any mass, any scar. This patient is a small mole, which may have been there by birth. So you examine for any scar, mass, any pulsatile mass, any pulsation. Color of the skin, if there is an acute infection like abscess, maybe skin may be hyperemic. And then if some patient may have got a mass in the midlobe of the neck which is attached to the larynx. Common mass is the thyroid or goiter. If there is midline swelling, you ask the patient to swallow. If it is moved with swallowing, then it is attached to the larynx, most likely goiter. You do the inspection, and if there is swelling, ask the patient to swallow. Go move. Then you put your finger in the suprasternal notch to make sure there is no mass there. So you have done the examination with inspection. Now palpation of the neck is from the behind. So you go behind the patient, flex the neck, and you do it in a systemic way. You examine, start with the suprasternal notch. And then comes the trachea, and your fingers should be like this. It should not be cold, it should not be very hot, just comfortable. If it is cold weather, it's slightly warm there. And examine the suprasternal notch with your fingers. Then comes the trachea. If there is a thyroid or goiter, you can maybe able to feel it. Then comes the cricoid cartilage. The patient neck should be flexed. Then comes the thyroid, cartilage, thyroid bone. And then the submental region to see any nodes or any other mass. Then comes the preauricular region. Sometimes there may be parotid mass or preauricular node. Then you want to examine the right anterior triangle and posterior triangle. So you flex the neck forward and to the affected side. You go to the submandibular region and examine for any mass, submandibular salivary gland or lymph node or any other mass. Then you go along the border, anterior border of the sternomastoid. And you palpate it. Not like that. Your palm of the finger should be against the neck, against the sternomastoid. So close up of the hand. Can you show the close up? Close up and now. Zoom. And so you start from the upper part of the neck, that is the submental, and submandibular is level 1, then level 2. And then you go along the middle part of the neck and then the lower part of the neck. Once you have done the anterior triangle, then you go to the posterior triangle, supraclavicular region, you palpate it, then move upward, posterior triangle like this, and then behind the pinna for the postauricular. On the left side, we have already done the submandibular, we do the submandibular examination. Both of them are level 1, then level 2. As I said, your fingers should not be touching like that, not like that, it should be like that. And keep looking at the patient face. There may be a tender mass. If the patient is making some face or grimacing, that means that it is tender. So you keep looking on the patient's face. You start from the upper part of the neck, middle part of the neck, and then the lower part of the neck, and then come posteriorly along the clavicle or the supraclavicular fossa, palpate it like this, and then move up like this, and keep looking at the patient face, and then behind. This is your inspection and palpation finished. If there are some instances in which there is a mass, like pulsatile mass, like carotid body tumor, so you want to auscultate. Sometimes there is a toxic goiter which may be very vascular, there may be some bruit. So you want to auscultate these mass. So if there is a mass, vascular mass, or you are suspecting a large goiter, toxic goiter, you must auscultate. This is basically, we finish with the complete ear, nose, throat and neck examination. The purpose of this video is for the medical student, and they should look at this video and then should also read from the books before coming to their clinical posting. If you come, once you have read the book and have seen this video, then you will have fair idea of how to do a clinical examination when you come for clinical posting in Department of Otolaryngology and Head and Neck Surgery. And I would again emphasize, come prepared, and then you must practice among each other first. I do not want my patients to be to cause any discomfort or harm to them. Obviously, as a beginner, I have been doing it for many years, so it may look easy. It is obviously going to be difficult. I expect that when you are going to examine this patient in the beginning, you will be making mistake, and it is fine as long as you are making an effort. And you will gradually learn. As I have learned gradually, you will also learn. But you must make an effort, and you must practice among each other first how to do the clinical examination, and then we will ask you to examine our patient in the ward and in the clinic. So I hope this video would be useful. We are going to make another video of history taking, how to take the history, or maybe we will show, if we cannot make the video, we can also show you, give you some lectures about history taking. Thank you very much.